A 65-year-old couple retiring this year will need $275,000 to cover healthcare costs throughout retirement, Fidelity Investments calculated in its annual cost estimate. In a perfect world, the largest expenses in retirement would be for fun things like travel and entertainment. In the real world, retiree healthcare costs can take an unconscionably big bite out of savings. A 65-year-old couple retiring this year will need $275,000 to cover healthcare costs throughout retirement, Fidelity Investments said in its annual cost estimate out last month. That stunning number is about 6% higher than it was last year. Costs would be about half that amount for a single person, though women would pay a bit more than men since they live longer. You might think that number looks high. At 65, you're eligible for Medicare, after all. But monthly Medicare premiums for Part B, which covers doctor's visits, surgeries, and more, and Part D drug coverage make up 35% of Fidelity's estimate. The other 65% is the cost sharing, in and out of Medicare, in copayments and deductibles, as well as out-of-pocket payments for prescription drugs. And that doesn't include dental care, or nursing home and long-term care costs. Retirees can buy supplemental, or Medigap, insurance to cover some of the things Medicare doesn't, but those premiums would lead back to the same basic estimate, said Adam Stavesky, Senior Vice President for Fidelity Benefits Consulting. The 6% jump in Fidelity's estimate mirrors the average annual 5.5% inflation rate for medical care that HealthView Services, which makes healthcare cost projection software, estimates for the next decade. A recent report from the company drilled into which healthcare costs will grow the fastest. It estimates a long-term inflation rate of 7.2% for Medigap premiums and 8% for Medicare Part D for out-of-pocket costs. The company estimates inflation rates of 3.7% for prescription drugs, 5% in dental, hearing and vision services, 3% for hospitals, and 3.4% for doctors' visits and tests. Cost of living adjustments on Social Security payments, meanwhile, are expected to grow by 2.6%, according to the HealthView Services report. What's really sobering is the impact of inflation on Fidelity's retiree healthcare cost estimates over the years. From 2002, when Fidelity first did an estimate, to its latest projection, the number is up 70%. It's the power of compounding, Stavesky said. It's great for investing and brutal for healthcare costs. In its 2017 statement, Fidelity brings up a fairly hot topic in healthcare circles, health savings accounts, or HSAs, as a way employers are helping workers manage costs. Others might describe the plans as shifting more of the rapidly rising costs of healthcare onto employees. HSAs are tax-advantaged accounts to which employees can contribute a certain amount of pre-tax dollars each year to use for medical costs. Employers usually kick in some money, too. The 2017 contribution limit for singles is $3,400, and $6,750 for a person with a family. Part of the logic behind HSAs is that employees will be better healthcare consumers under such plans. And they might, if being an informed, effective consumer weren't extremely difficult and time-consuming in the murky world of American healthcare pricing. On the bright side, financial planners love that HSAs are triple tax-advantaged. Money goes in pre-tax, earnings on that money aren't taxed, and the money can be used, without being taxed, for qualified medical expenses. If people have the means to pay for healthcare costs out of pocket and leave the HSA money growing tax-free, it can be another tax-advantaged way to save for retirement. Healthcare costs will likely keep climbing, so one of the best investments anyone can make is to work at staying healthy, if possible. For a sense of how much healthcare could cost you in retirement, and how staying healthy can lower those costs, try AARP's Healthcare Costs Calculator. It provides a rough cost estimate based on your height, weight, gender and state. Users can add in various health conditions to see how much they might add to projected healthcare costs in retirement, or subtract from them if, for instance, an overweight person slimmed down. Whether you're a 60 or 25 or somewhere in between, the prospect of retirement should be more inspiring than the anxious business of wargaming what your health will be like 10 or 20 or 30 years out. But if paying closer attention to your body and mind now means more money for travel and growth and relaxation after a long hard-working life, it's not a bad trade-off.